I'm talking about a very specific piece of testimony in the Lindsay Clancy trial, specifically testimony that was given by her ex-husband, Patrick Clancy. And in that testimony, he talked about how about a week after the murder of the children, he had a phone conversation with Lindsay. And in his testimony, he talked about how in that call, she did not talk about the children, but instead, she talked about her own experience. She herself, she talked about what she had been going through herself. And this is a very clear example of a behavior that we can look at from a few different possible psychological, theoretical explanations. Now, many people may take that specific behavior. About a week after the death of her children, she didn't talk about her children, according to Patrick's testimony. Now, some people may take that behavior and interpret that she didn't care, that she wasn't focused on the feelings of them. But at the same time, it's really important to understand psychologically what a person can be going through that can cause them to engage in that behavior. I'm Dr. Seth, psychologist, and the first example of this we can look at from psychoanalytic theory. Now, what psychoanalytic theory would say is that the ego's goal is self-preservation, is psychological survival in a very complex world. So according to psychoanalytic theory, it could say that after a person engages in any horrific act, let's say a week later in conversation, that individual may not verbalize a real focus on the feelings of the victims. Why? Because to do so, to focus on those feelings could cause emotional collapse. Remember, psychoanalytic theory, as I've explained, the purpose of it is self-preservation. So to focus on the feelings of victims could really cause the person a sort of emotional panic, an emotional crisis that the ego may tell them they could not come back from. So this is sort of a psychoanalytic theory explanation of it. Now, the next psychological theory that we can look at is a behavioral explanation. So according to behavior therapy, take any person engaging in a horrific, violent act. A week later in a conversation, they don't appear or verbalize being focused on the victim's feelings. Why would that be? Well, a behavior theory, a psychological behavioral theory would say that talking about the feelings of the victims, that thinking about those feelings, those victims and what they went through would cause such extreme internal distress and anxiety, what behavior therapy would call an aversive reaction. That aversive reaction, that distress must be avoided at all costs, which would look like not discussing it, not talking about it. Next, I'll share another psychological, theoretical orientation that can try to explain really confusing behavior, and that is the cognitive behavioral theory. Now, CBT for short. CBT, this orientation, believes that one has certain core beliefs. Now, CBT may say that an individual who engages in horrific behavior but a week later doesn't focus on the victim's feelings or isn't verbalizing that underneath it, that individual may have certain negative core beliefs. For example, a core belief feeling like, I am bad, I am terrible. That these negative root core beliefs can trigger incredibly painful automatic thoughts. And all of these thoughts create incredible anxiety. And as a result, a cognitive behavioral explanation would explain that these experiences would be so upsetting and so painful that the individual must find a way to distract themselves from experiencing that, must find a way to escape the intensity of those feelings and avoid it. Cognitive behavioral theoretical orientation, by the way, this is the one that is most commonly used, for example, in courts. And cognitive behavioral theoretical orientation recommends the use a lot of measures and standardized assessment tools that can be referred to help gain actual data about what this individual is experiencing. And as I review some of these possible psychological explanations for very confusing behavior, it makes me think for a moment about some of the recent cases, let's say in the past 15 years, murder cases in which an individual, the defendant's mental health is being combed through in the trial process as extremely and intensively as it's happening in this Lindsay Clancy trial. I'm thinking about a trial that I provided a lot of television commentary on, the case of Jodi Arias. In that trial, they combed through actual psychological testing reports, testing data about Jodi Arias. And this was a case that was really so complex, and it was very difficult for people to understand psychologically exactly what was going on. Well, the mental health of Lindsay Clancy is certainly front and center in this particular trial. Now, the last psychological explanation that I want to discuss is about a psychotic process. So if you take an individual who engages in a horrific act, one of the possible explanations that may apply to that particular person is that they were experiencing an active psychotic process at the time. Now, we don't know that. Certainly, in order to know what was going on with Lindsay Clancy, one would need to have a full assessment, as much psychological testing, as many measures as possible, and then also as much collateral information from others who knew her. All of that would really need to be drawn upon. But one explanation, if someone engages in a horrific act, they may have potentially been going through a psychotic process at the time. Now, when that happens, okay, why might an individual not be focused on the feelings of their victims and what those victims went through as a result of their action? Well, in the case of a psychotic process, the individual almost feels as if they have been hijacked, and it can take the form, for example, of hallucinations, hearing voices, sometimes what we call command hallucinations, telling a person to do something, or it can also take the form of delusions, beliefs that completely break with reality. So why this is important is if an individual is currently in the midst of an active psychotic process, they are detached from reality, which would cause them to think more about things that other people would expect, like other people's feelings, other people's experiences. Why? Because they feel as if they have been hijacked, as if their brain has been hijacked. Those are a few possible explanations. Now, the last point that I want to make before I close is about Lindsay Clancy's demeanor, her demeanor at times that has been seen in the courtroom. And it appears that she shows that she is in true emotional pain and distress at times as a result of what these proceedings are discussing, the deaths of her children. Now, this is different than what you see sometimes. Sometimes you may see an individual who commits a murder and maybe they are acquitted. It appears that they have gotten away with it. And then later, what you see is it appears in some ways on the surface as if they have gone on to live sort of maybe what you imagine is the life they always wanted. Now, when you take an individual who is acquitted for murder, and it appears on the surface like they have gone on to live almost like a fantasy life for them, when you take that image and you compare that to what appears to be the case with Lindsay Clancy, you realize that Lindsay Clancy does not appear to be somebody who is living her fantasy life.